Alright, so today I will be performing a GI examination on this patient. So I'll begin by, I've washed my hands already, and then you'll have them pull up their shirt so you can see their abdomen. And you'll start with some general inspections. So you're looking for any scarring, stretch marks, or the shape, the general overall shape of the abdomen. And then next would be auscultations. So we do this by 4 quadrants. The umbilicus, or the belly button, is what determines the boundaries for those quadrants. So if you do a lateral line across the umbilicus, that divides it into upper and lower quadrants. And then if you go a vertical line into left and right, and it's based on the patient's, so this would be patient's left upper, left lower, right upper, right lower. And we auscultate in those 4 sections. So you take your stethoscope, you use the diaphragm, place it flat on their abdomen, and at this point you'll mostly just hear vowel sounds depending on if they've ate recently. If you auscultate for more than 5 minutes and you don't hear anything, then they have an absence of vowel sounds at that point. And then if you do hear anything, it'll be like some gurgling or maybe some like swishing around of materials. And if you don't hear anything abnormal, that's pretty good. And then next we have palpations. So there's 3 different kinds. There is the light palpations, which is just assessing for general tenderness of the area. So you palpate in the 4 quadrants and you assess by looking at their facial expressions to see if they are tender. You use one hand, placing your fingers flat, and you just do a gentle swirl, and you move in the 4 quadrants. You're not pushing very hard. This is just for tenderness. After you've done that, the deep palpations are next, so it's in the same 4 spots that you just palpated, but at this point you're going to be resting your bottom hand, and then you'll be placing pressure with a hand on top, going deeper, and then the same swirling motion, and this is assessing for masses in any of the quadrants. These ones will usually, they'll feel a little more tender just because you're pushing pretty hard. But if you don't feel any mass, that's good. The next thing is special palpations, so there's 2 of them that we'll be performing. The first one is for the liver, so this is in the patient's right upper quadrant. There's 3 techniques for the palpation. The first one is you start in the lower quadrant. You have your hands vertical to the patient, and you are moving up and down. And as you approach the rib cage, if you happen to feel their liver underneath it, that means it's inflamed. The second one is where you'll most likely feel the liver during palpation. So you take one hand and place it underneath the rib cage, and you lift up. Then you have the other one coming right at the border of the rib cage, and you instruct them to take a breath in. And you push up. And then at that point, you will feel the liver as the diaphragm pushes it down. And if you don't feel it there, the third one is the hook test, but I won't be doing that just because it's a little uncomfortable. But basically, you would hook your fingers underneath the rib cage and ask them to take a deep breath, and you'll be able to reach further underneath, and at that point you should feel the liver. The second special palpation is for the spleen, so that one, you will again place your hand underneath the rib cage, lifting up, and this time you're going to be coming in at a 45-degree angle with your hand and wrist, and you are pushing in as they breathe in, so you want to make sure that you instruct them to take a deep breath. You push up, and then on an exhale you can release. With the spleen, you won't be feeling anything unless it's 2 to 3 times enlarged, so that one we're just mostly seeing if we feel anything or not, and if we do, that's a bad sign. The last step is percussions, so you do it in the same 4 locations that you auscultated. You have 2 fingers, place them flat on their stomach, and here we're just listening for a difference in the sound. And the upper 2 were a lot more dense than the lower 2 sounds. But at this point, that is the end of the GI examination.